A wheat field like this is a pretty classic landscape across the Canadian prairies. But imagine trying to walk through this passage of the field without touching any of the grains. For someone like me with celiac disease, that is kind of what the day-to-day experience of eating can be like. In celiac disease, wheat is the primary grain that causes an autoimmune response by damaging the small intestine. It is not a food allergy or sensitivity per se. And wheat is very difficult to avoid in our modern diet, as tiny amounts can be enough to induce symptoms like abdominal pain, extreme fatigue, and migraine. And the issues extend beyond symptoms themselves. When the small intestine attacks itself, it can't properly absorb nutrients, and so individuals are also at risk for developing other conditions like diabetes, depression, and even cancer. And so while we know a fair bit about how celiac disease works internally, we don't know as much about it externally at a population level. For example, how many people in Alberta even have it? Well, with my research, I'm aiming to build the foundation to start understanding the burden of celiac disease in this context. How is that possible? Well, you may be familiar with the phrase, the Alberta advantage. We now have what I like to call the Alberta health data advantage. We are uniquely strong in having so many high-quality health databases across the province. Every time we interact with the healthcare system, information gets stored in a specific database. When we go to our family doctor for our annual physical, when we get blood work done to check for any abnormalities, and even when we fill out a prescription for some type of medication. And so by linking these unique encounters across databases, I can determine every individual screened for and diagnosed with celiac disease in the past decade. I can also identify gaps in care among vulnerable patient groups and even assess for early life risk factors such as childhood antibiotic use. And it's really important to understand this type of data for healthcare policy and planning. Additionally, the only current treatment for celiac disease is diet-based, which is expensive and causes stress for patients and their caregivers. Finally, my early findings show that rates of new disease are highest in children. Without a cure, these individuals will be living with celiac disease for the rest of their lives, causing strain on patients, their pocketbooks, and the province. And so, with my research, we can work towards making this path in the field a bit wider so that living with celiac disease isn't so treacherous for current and future generations.